Hello, hello, hello. Assalamu alaikum. Jiarum pakhair raghaleni hama chune shume washmale hi gonzaimes guten morgen. Hi, hugs and hellos to everybody who's tuned into PT1 and PTV Global at the same time. You guys are watching World This Morning alongside Shazad Khan and Maha Makhdoom. Hello, Maha. How are you?
I'm very good, Shazad. Thank you very much for that wonderful, clear introduction. It was beautiful. And I love how you have incorporated your new hello.
Yeah, thank you very
Very
much for
smoothly
that too.
done.
And ladies and gentlemen, the only reason that I emphasized on Maha's name was that she had several issues with the pronunciation of it, and thank God that we are over it because I incorporated it very well as well.
Because of communication.
Yeah, the communication is there, thank God, and that's how shows work. That's how
Exactly.
the energy drives the other people crazy. They get out,
Yeah.
rise and shine, wake and bake.
Yeah.
But Maha, today
Yes.
is one of the very most important days as well, and this month is a very important month.
Yes, it is, exactly. And as I always say to you, because I love to say it, it's a very important show because I do think every show we do is important. But no, the month is very important because Pakistan actually has the highest rates of this in the female population in the whole of Asia. 1 out of 9 women suffer from this as well. And Shazad?
Yes, and people might be thinking what we were talking about, but you would love to call this month October, but we love to call it Pinktober because of the fact that it's Breast Cancer Awareness Month. And all month long, you've heard programs on television, radio, everybody's talking about it. And the only reason is that we've got 90,000 registered cases of breast cancer every year, and 40,000 of those women die just because of the fact that they weren't aware and they didn't go to the doctor as early as they were supposed to.
Exactly, and also, we'd like to highlight, because we like to highlight the organizations and the people that are working on raising awareness and helping the people of this country. And it's actually the Pink Ribbon campaign, which has been observing this month. So to discuss the situation and raise awareness within Pakistan and see what we can do, we've been joined by some wonderful guests in the studio. We've been very lucky. We've been joined by Mr. Umar Aftab, who is the CEO of Pink Ribbon campaign. Assalamu alaikum, good morning. Thank you so much for joining us today.
Thank you very much for coming over. Still very graceful. You've been coming every year and you've been working hard for this campaign.
Yes.
Hats off to you.
Thank you so much. Besides Mr. Umar Aftab, we have been joined by Dr. Uzma. She is a consultant oncologist and works in the radiation department. Assalamu alaikum, good morning. Thank you for joining us. Besides Dr. Uzma, we've been joined by Miss Catalina Allende, who is the principal of the University College Islamabad. Assalamu alaikum, good morning.
And is a brave survivor and a fighter.
And
she
yes.
fought with the disease as well, and she's here to share her own experiences as well. But Mr. Umar Aftab, we'll start the conversation with you. You've been here every year. We have been celebrating Pink Ribbon Days. We have been observing it. We have been spreading awareness. Is it getting any better?
Well, first of all, I will start with a more horrifying figure,
Oh, don't
and
do that.
that's 10 million women in Pakistan are at risk of breast cancer.
Okay.
So, which is like 3 times of the population of Islamabad. So the risk and it's like horrifying. So, and then when we talk about this awareness, so it's just the beginning, because at least now people have started talking about it, but when we go at the very grassroots level, still it's a big taboo. The other day I was talking to someone, and the lady told that even her own mother died of breast cancer, and she only got to know about it when she died and she was giving her bath to the body, and then she found out that she had breast cancer. She never
Wow.
told even her own daughters that she was suffering from breast cancer. So still, unfortunately, this disease should be seen as a disease, whereas it's more seen as related to women's sexuality. So we still need to break this taboo around this disease, that breast cancer is a cancer like any other cancer. It can grow in any part of the body, and this is just a disease. So in many parts of Pakistan, still there are misconceptions and beliefs like that. For example, people think that this is something like HIV/AIDS. So that woman has done something wrong, and that's why she got this disease. So still, at least with all of these campaigning in last few years, at least now people have started talking about it, but it's a long way to go, and it's a huge issue still for Pakistan.
No, but is it getting any better? Because we have been doing several programs on it. We have been inviting people. We have been sharing all the information. So it should actually get some,
Yeah,
or a little bit better.
One good thing is that now there is 30% increase in patient turnout in breast clinics across Pakistan.
Okay.
So that's at least a good news, and there is a slight decrease in the mortality rate because now women have at least started going early to, and that's the whole cause, and that's the whole objective of the Pink Ribbon campaign, to
Early detection.
the early detection. So, and with early detection, the chances of survival are more than 90%. So that's the whole theme of the Pink Ribbon campaign, to educate
Exactly,
women on
and
early
that
detection.
calls for a fist bump as well, Ma. I think we've done a
Why?
great job.
Why?
All right,
Why?
fist
I
bump.
don't understand why
Because
fist
the
bump is-
mortality rate is going down.
Oh.
People are talking about it. 30% has increased. We are not taking all of the, advantage of the situation, but at least 15% might come to us.
Okay, so that's wonderful. But Dr. Uzma, I want to ask you. Mr. Umar has highlighted that there's lots of misconceptions. So let's raise some awareness as well, because some people may not know, even some of our viewers. But who is more at risk, or who is more likely to get cancer? I mean, any one of us sitting here.
And what is the disease itself? What
Yeah.
are the earliest symptoms?
Well, all females, if you're a female, you are at risk.
Okay.
And there are some other factors that also increase the risk, but unfortunately, we do not have our own statistics in Pakistan that highlight those risk factors. We've got just the risk factors from the West, in which they found their own patients, in which there was a higher risk of cancer if the females, they did not marry, or they did not have early childbirth, or they didn't breastfeed their children, and there was a genetic risk as well. But in our patients, we do not see these risk factors. Our females, usually they have multiple children, they have breastfed all their children, and we have yet to find out
Why
what
is
are the
that?
main
'Cause-
risk factors in our country with such a high rate we are seeing of breast cancers.
Okay.
And what was the other question you asked?
Okay, the other question was, what are the
Symptoms.
earlier symptoms? Is it malnourishment? Is it some other factors?
Lifestyle. What is
Well,
it?
all these malnourishment and everything, these are the risk factors. The symptoms come up only once you have developed the disease.
Okay.
So the earlier symptoms you can just say is just a change in the breast skin, or appearance of a small lump in the breast region or in the armpit region, or there may be a discharge from the nipple. And usually these are, I think, mainly the earliest symptoms. As for that, we do emphasize on monthly breast examination, and we highlight on these symptoms so that the females, when they do examine their breasts, they are aware what to look for.
And what are the procedures of examination as well, which are available within hospitals or different labs?
Well, when the patients do come to us, we do their clinical examination, and because there are many females now coming up with a lot of awareness going on. Many females are coming up with just a slight nodularity in their breast or having pain in their breast. So we have to clinically examine, and we have to convince them that there's nothing wrong. This is just a normal thing. But there are some patients in which we do feel that this needs a next step of investigation. So we refer them for ultrasounds or mammography. And if on that also we are again more suspicious, then we go for a fine needle aspiration or a true cut biopsy to confirm.
Yeah.
So, but one of the other ones, so the mammogram, that's all part of it, or is that an outdated way of checking if someone's got breast cancer?
No,
where does that
it's not at all outdated. It is one of the most authentic tests
Okay.
that the females do get. But the thing is that the females under 40 years, it's usually not very good in highlighting the disease, because the breasts are dense. It's only above 40 that
Okay.
it is recommended. Younger than 40, we recommend an ultrasound.
Okay, but
right.
there's one more thing which I wanted to ask the CEO of the Pink Ribbon campaign, and that is that, she very rightly mentioned that quite a lot of people are coming in now just because of the awareness programs which are going on. Good news. But now it's hard for them to believe that they do not have this disease. So are we pushing it too much?
No, again, as I mentioned earlier, that 10 million women in Pakistan are at risk of breast cancer. So we are just talking about for example, Islamabad, and if we go out 50 kilometers out of Islamabad, so it's a totally different world.
Yeah.
Still today, women, they would go to a local barber and they would get, you know, their lump cut by a blade, thinking that, you know, this pus will go away and it will be fine. So
And it's happening.
it's happening in Pakistan in like
I
lots
mean,
of.
if people can get their son circumcised by a barber, I think that can be a normal practice
Gosh,
as well.
this is the thing.
So
but-
whatever, you know, there are like two sides when we talk about Pakistan. One is like some metropolitan cities like Lahore, Karachi, Islamabad, and then when, you know, it's 80% of rest of Pakistan. So still it's a long way to go. And you know, for example, we got a call from Islamabad. A girl was diagnosed. She was 18. And we have a helpline and people call in for advisory services. So she, you know, her family refused to take her for further treatment. They said, we don't want to tell anyone that, you know, our girl has breast cancer. And it's about Islamabad. So still it's a, you know, it's a big taboo and it's a long way to go.
So you would rather, people would rather risk their child's life over what reputation and what people say. That's
But
very
please
clear.
share your helpline number as well. So,
Exactly.
you know, for somebody who's watching and, you know, if they want to ask, they can probably call
Yeah, so
you.
it's 042
042, and it'll be on your television
Yeah,
screens as well,
042.
ladies and gentlemen.
358372226.
358372226.
226. Okay, great.
You can repeat
okay. So it's 042 358372226. But now moving on to Miss Catalina. You're a survivor, a breast cancer survivor, and also you are helping raise awareness. So if we could start with your story, if you tell us about that'd be fantastic.
How terrifying was it for you
Or was
when
it
you
terrifying?
initially figured it out?
I don't think so. First of all, my first mammography, I had it when I was my first job back in Chile, and they found a nodularity on my breast. So they asked me for a mammography. So back in my 30s, they made a mammography to me. And the doctor, then I was referred to a surgeon who quickly wanted to operate. Then my sister said, always ask for a second opinion whenever you have an operation. And the other doctor went further and said, maybe this is not required, and it was just nodularity, so it was not required. So I knew I had this issue of nodularity on the breast, so I would not be able to actually detect a tumor or something, because it was already, you know, with nodules. So I always kept a check. When I had two children on a late age, and then the doctor will, my doctor will check also. I asked him to check. And so I've always been aware, and you know, I had this habit of doing the mammographies every 2 years after 40. And then I will combine maybe an ultrasound and then a mammography like that. So when I went to the mammography in 2008 to Nuri, I just thought it was going to be one more, right? And I was not scared because I used to do them. And then when they called me again, we want to do another one, what's happening? Then I was really worried.
Yeah.
And when they called me for the second time, and obviously at that time it was detected and it was not even palpable. So I had the nodules, but I had the tumor was appearing in the mammography, but it was not palpable.
Okay.
So when somebody has a risk like I had, I did these mammographies on a regular basis, and I think that saved me.
Okay.
Because it was detected early.
Okay.
In at second stage, it was second stage. So
Okay.
it was early detection, thanks to myself being you know, aware that I could have a problem.
Exactly.
Because I had some of those risks that she was talking about. I got married late, and I breastfed my children, but I only breastfed 2 children, not 7, you know. So obviously it was, and in my family there is cancer. Not breast cancer, but cancer like that there is.
It's in the genes.
Huh?
It's
So it's in
genetic.
the
There is
genes.
something, yes, unfortunately, yes. So
Okay.
that's one thing that got me always worried to be on the look of anything.
And then you got it treated over here in Pakistan?
I did it in Nuri.
Okay.
And very happy to have it done over there, because it's one of the hospitals that really have access to a lot of different people.
Yeah.
And you see poor people, well-off people, all sorts of people though in there, and a very, very committed, you know, number
Staff.
of doctors over there. So my experience in Nouri was very good, though, you know, people were asking me, why didn't you go to this or that other place? And I said to them, you know, I didn't like it here or there for X, Y, Z reason.
Okay, that's really important. Like, we need to highlight this as well, because I know that within certain segments of the population, there are certain hospitals that stand out in regards to the work that they're doing in this area. But actually, there's quite a few hospitals that are working specifically on cancer and breast cancer. So tell us about this.
Yeah, so first of all, when we look at the population of Pakistan and then we see hospitals providing cancer treatment, they are much less than what we need.
Yes.
But Pakistan Atomic Energy Commission, for example, many people would not know that they have 14 cancer hospitals, and for example, Nouri is one of their hospital, and then there are other hospitals in, for example, in Quetta, in Bahawalpur.
Nouri helps the underprivileged as well, right?
Yeah, and
Totally.
they really provide good services and free services to poor people. And then on the other hand, Pink Ribbon Campaign is now setting up Pakistan's first dedicated breast cancer hospital. So
Right.
this hospital will specialize just in breast cancer. We have started the construction of the hospital in Lahore, and in next 2 years it will be up and running, inshallah. And this will be the first ever hospital dedicated for breast cancer.
And state-of-the-art technology.
State-of-the-art technology.
Now, I want to come back to the point that you realize that 80% are living outside of these cities and outside of these, populated areas. So how are we going to reach them? Because they're the ones that need the awareness and the treatments. So, setting up the hospital in Lahore, how will that benefit the rest of the 80%?
So one is that we are running a very extensive youth awareness program. So we are going to colleges and universities across Pakistan. So any city, everywhere we are going, and in last 3 years we have reached out to almost 600,000 young girls across Pakistan through these colleges and universities. On the other hand, what we have done is that with the support of Ministry of Health, so we have got included this breast cancer in the training program of lady health workers.
Okay.
So these lady health workers who are spread across Pakistan, they are now also trained on this issue of breast cancer. So when they go out in fields, they now also talk about this issue with women at the very grassroots level.
All right. Okay, but then, there might be a few challenges, which those team members might face talking to the people within the rural areas. What are those challenges when they come back? What do they tell you that, this is the response we've got?
So it's a social and cultural taboo. So, for example, many women would not even talk to women on this issue. They would not allow women to get themselves checked. And then, unfortunately, in Pakistan, for example, we have, one doctor for 1,300 people. So human resource is already very constrained. And then when it comes to female doctors, for example, in Pakistan, we have like maybe 15, 20 female oncologists across Pakistan. So, and for this disease, women, they would want to go to a female doctor.
Absolutely.
So, infrastructure is an issue, then human resource is an issue, and then I think most of all it's the cultural taboo and the issue. It has more to do with the women's sexuality. That's the issue which we are facing.
So this is what I want to pick up on, because that's what we also learned as well, that the figure of females within medical schools is above 70%. Yet who go into actual working life as doctors is about 25%.
No, but even if they'll go into that work life,
yeah.
either they'll become dermatologist or probably, just
But
physicians,
unfortunately,
that's it.
and these are not generalizations, this is unfortunately what's happening. But I want to bring Ms. Catalina back into the conversation. You've spoken about your experience. You go around and you try to create awareness. These taboos that are associated with it, are we slowly overcoming them, or how can we overcome them? When you speak to people, what are your feelings?
It's amazing. I had the disease, and my sister-in-law had the disease. And she was doing them, and she was doing this, and she was doing that, and I had to go over and visit her and convince her to go further. I read her reports, and I said, you have to go further. You have to go to Pinom, which she was in Faisalabad. So eventually, and even sometimes people have this issue, they have the cancer, and they don't do the chemotherapy afterwards. They are worried about their hair falling down. So sometimes that is when you have reoccurrence. When they have the disease, they are not understanding the disease, and then they get the lump out, maybe by a good doctor, a good surgeon, but then they don't do the chemotherapy.
Exactly.
That's
And we will
another
definitely
issue.
pick up on this, but right now, ladies and gentlemen, we have to go for a very quick and a very short break as well. Please stay tuned, don't go anywhere, because when you guys are going to come back, we'll talk about the different treatments available within Pakistan, and then she as a survivor, why did she face so much of difficulty in convincing other people that, you know, there's something which might be wrong. Let's take a break. Good morning.
Welcome back, everyone. And today, on today's show, we are observing Breast Cancer Month, and it is being done by the Pink Ribbon Campaign. And it's very important because we're talking about what the situation within Pakistan is. And as you, for those who've joined us, it's dire. 90,000 people, reported women, are coming in. 40,000 are not surviving because of late detection, not the right treatment. Not
And
the
out
right
of 9,
one out of 9, exactly. And they're not even, even once they're aware, we're learning, even, educated people are avoiding treatment for very superficial, not really good reasons. So now let's come back to Catalina. Once you went for the second opinion and, you were advised to get the operation, a lot of people go against it. Why do you think that is? Why do you think there's such a reluctance to accept the fact that they have this?
Well, I tell you, it's very difficult when somebody tells you we are going to cut a part of your body, which is so part of your own identity. So, going for a mastectomy is a very hard thing and very difficult. But one has to put things into context and priorities. And obviously, if that's what is required, that's what it should be done. Luckily now, there are many interventions that not need to be so massive. But that's one thing, The second thing is the treatment itself, the chemotherapy, the loss of hair. Another thing that goes into the female identity, the long hair and all that. So then people are worried about that.
Okay.
And the other thing is these taboos about sexuality, that you've done something wrong and all that. So unfortunately, it is happening, but I'm very happy with the Pink Ribbon that has put this into everybody's, awareness. So people are having less of these taboos, have been not debunked completely, but you can say it's good people talk, and I have many times people call me
Yeah, that is
went
great.
through these.
That's what I wanted to ask, that, whenever you're a survivor, people do call you, for example, if they go through the same disease, they'll call you for the second or the third opinion, that how was it for you? So is it still hard to convince them, or they are already convinced, half convinced?
Since I'm looking well and healthy and all that, they feel encouraged to go ahead, I think it's really important that there are the survivors that can talk to those survivors that are being a little bit reluctant.
Okay.
So more convincing than a doctor, I think it's sometimes maybe seeing somebody else that have gone through the whole process. So there is unfortunately not really officially, but there should be like a sort of network of survivors like me that are willing to go forward to support the doctors whenever
And talk
there's
about
an
this
issue.
as well.
And talk about
talking
it.
about this.
And luckily in the college where I am the principal there, when people know about my problem, they do come to me and ask. And I have helped a lot of people that have gone through it, their mothers have gone through it. And then obviously I have a science background also, so I sort of understand the whole thing.
Okay.
Very wisely said, but then there's one more thing which I wanted to pick up on. And that was that, half of the time when you see such cases, they can only be survivors if they went to the doctor in an earlier phase. If they had this thing in their head that, there's something wrong, probably we should go get ourselves checked up. only then you can be a survivor. I don't want to give you a negative vibe about it, even if it had been very late. But we have got Dr. Saib over here. We'll ask about the different stages and what the treatments are and whether they are available in Pakistan or not, or whether they are cost effective or not. So Dr. Saib, your turn now. So
Well,
different stages of it. When can a person
Basically,
survive
all the
and
questions
not?
for the
Yeah.
rest of the show. So, what are the different stages? What are the different treatments? And yeah, and the costs.
well, the stage, there is a standardized system of staging, and it's clinical, how we examine and we measure the size of the lump, whether the armpit nodes are involved or not, that affects the staging. I wouldn't go into the detail how much tumor size is first stage or second stage or third stage. That's a little technical. But there is, and we'll just categorize it into an early stage when it's just limited to the breast, and an advanced stage when it has involved the skin or the armpit nodes. So, and there is the last stage, stage 4, when it has spread to rest of the body.
Okay.
So the treatment options also differ depending on what stage you present in, but the prognosis, it matters the most, because earlier stage there is complete cure, we can guarantee. We usually give a 5-year survival rates to the patients, and it's about, in the first two stages, it's about 90 to 95% with treatment. But in the third stage, it drops down to 75%, and in the fourth stage, whatever treatment you do is just for the, you can say, just control of the disease, but you can't cure the patient.
Okay, so and the thing is, we'll come back and discuss other treatments as well in a moment, but we have to go for another short break, and when you come back, we will continue our conversation with Dr. Uzma. Stay tuned.
Indeed. All right, people, welcome back once again. Thank you very much for tuning into World this morning on PTV World. And today we're talking about breast cancer awareness because it's Pinktober, it's not October. And earlier we were in conversation with Dr. Uzma, and she was actually telling us about all the different stages of the disease. And now it's about time that we talk about the different treatments and ailments which are available.
Well, more or less, all the treatment is standard worldwide, and most of it is available in Pakistan in our hospitals, as Umar Aftab Saab mentioned, in Atomic Energy Commission hospitals. We've got full treatment options available at Shifa International, and other hospitals as well are catering to all the treatments needed for a patient diagnosed with breast cancer. But why we are so much emphasizing on screening is because the earlier you are detected, the lesser is the treatment that you have to follow through.
Okay.
Like if you're having a regular screening mammography and the disease is diagnosed in just the first stage, we can advise just have just removal of the lump. That's the surgery, that's the maximum surgery that you have, and followed by there are certain features that we do study on the lump, on the histopathology. Based on that, only some hormonal treatment may be sufficient for the patient. But this differs depending on so many factors, and one of the main factors is the age at which you are diagnosed.
Okay.
We see that the earlier the patients are diagnosed, that is at early age, less than 40, the disease is very aggressive. So
Okay.
even if it is diagnosed in stage 1 for patients less than 40 years, they have to go through some form of chemotherapy, because we have seen that even if we leave it like that, it may have a higher risk of recurrence.
Why is it more aggressive though?
I don't know. This thing is in Pakistan, but we get the standards, all the standards of treatment we do get from the West. And initially, there were the doctors that were coming from abroad.
Okay.
They used to follow those standards. And then they saw a lot of recurrence in our patients. They said, we didn't see that there. And here we follow those same protocols, and the patients are coming up with recurrence.
Okay, so then obviously then that then goes into after treatment, then they must be doing something after post-treatment, you know, in their kind of lifestyle and etc. But this is what I want to ask before we move on to lifestyle and controllable risk factors from Mr. Umar, is that why do we still, you know, not have these figures, and why are we still depending on the West for, you know, these kind of theories
And the reasons are still unknown.
Yeah, unfortunately, first of all, we don't have national cancer registry in Pakistan. And that's a WHO standard everywhere in the world, that they have this national cancer registry where they can record all the statistics, and we can see that what are the trends age-wise, area-wise, and which
So
cancers.
we don't like research anyway.
Yeah, that's and then
I like
unfortunately.
research, I'll do it.
So Pink Ribbon has signed an MOU with Ministry of Science and Technology, and we are planning to have indigenous research to see that why it's so much higher in Pakistan. Even if we compare it with India, you know, 70 years back we were like same people, and even in India the risk factor is 1 in 22. So in Pakistan it's 3 times higher than in India. So we need to really see that what are the risk factors. Another alarming trend in Pakistan is that we are seeing young girls having, you know, with breast cancer. Globally, it's with age. So the higher the age, the more the risk. But in Pakistan, we are also seeing young girls being diagnosed with breast cancer. So that's another alarming.
And we don't know why.
We don't know why.
That's quite scary, and
It
that's
is.
very worrying for all the parents out there who have young daughters. Okay, so now let's move on to this, the controllable risk factors, because we talked about the symptoms, we talked about genetic, you know, tendencies, etc. So now what about the other factors? Let's start with that.
So lifestyle is very important. With the changing lifestyle, that's, you know, one thing which we definitely know that's a risk factor. Exercise is very important because obesity is also linked with higher risk of breast cancer.
Okay.
Then this, you know, smoking and alcohol intake. So these are like some of the risk factors which can be controlled, because other risk factors we can't control. But at least what we can do is that we can, you know, aware people on the controllable risk factors.
Okay, so now, Ms. Catalina, I want to ask you, you know, what you had a certain lifestyle. You know, you went every 2 years, you got regular screening, regular checks. But how difficult was it post-operation, you know, once you had been diagnosed, to keep up that lifestyle that, you know, because you were living healthily before, you still managed to, you know, you still got it, the disease, but then you also managed to be okay. So what did you do?
Well, I looked.
Did you change something, or did you continue?
Of course, I did change my diet.
Okay.
I'm eating much healthier now. I take at 11 a juice, you know, one of those fruit juices with everything that we. So I have a much healthier lifestyle. Okay. I've reduced the meat intake, for example. So I am trying to do something on that area. I have did a big effort to reduce weight. That was very difficult because after chemotherapy, they give you so many steroids and all that you put on weight.
Okay.
So I have managed to reduce, not as much as I would like, but I would say I'm almost normal.
No, you are absolutely.
So that was important because, as he says, we have obesity is an important reoccurrence factor. So I'm trying to work on that.
Okay.
I don't walk as much as I should.
Okay.
I bought my cycle and it's standing like a trophy there rather than myself using it. So
cycles are always,
do.
Okay, but now the thing is, I want to ask you in regards to the eating habits, because, you know, what I'm thinking about is the Pakistani population, our tendencies, our habits, the way we live life. You know, we like our foods, we like our heavy foods, like Kaleems, Naharis, Naans. How difficult was it for you to change your lifestyle? Like, as in, you're much more healthy now.
I never ate those things. That's never a problem for
obviously.
me.
Oh, there you go.
'Cause you're not from here.
But I tell you that you see, for example, my cancer has estrogen. It was positive to estrogen. Now, estrogen is a hormone that is there on the fatty tissue. So the more fat you are, the more estrogen you can have in your body.
Yeah. Very
good.
So being able to reduce weight
Yeah.
goes a long way as a lifestyle.
Okay.
And a lot of the people that have cancer, many of them are overweight.
Yeah,
Now,
yes.
there was another thing that I was told, I had it over 50, and I was given an you can say, menopause type of
Medicine?
herbal thing.
Okay.
But I think that was not good at all for me, right?
Okay.
So even though it was herbal, but then, I should have not taken it. Had I
Okay.
known, had this effect, I would have not done it. So
Okay.
I am also worried about those, even doctors recommend these things. You see, there's another issue here. Doctors, MBBS doctors are not aware of cancer and what they should ask their children. And so, I have seen doctors recommending for women that have polycystic ovary, they recommend a drug which is basically a tablet that has estrogen. And that should not be done. So they never ask, is your mother
So I
had
think
cancer?
it's the
They
people's job
should
to
ask.
actually ask.
Yeah, but hold on. The reason you go to a doctor is because they've gone through at least 5 years of studies.
No, but that's where I was leading to, that, there are majority of people, they just cannot afford to go to the doctors. So what they do is they look for alternative methods.
Sad.
And what does your organization say about that? Because there are quite a lot of quacks out there as well, and then there are people who claim that, we can
They make
do
things a
some
lot worse.
spiritual treatment. Do you have any
that's
research on
that's
that?
also something which we have seen in many people calling in, and they would not go to a doctor, rather they would go to some spiritual healer or a hakim or homeopath, and that's a very important issue, because the more they delay going to a doctor, the more it becomes fatal.
Exactly.
Okay.
And one last thing which I wanted to mention before you go towards the preventative surgeries, there's one more thing which I wanted to discuss, and that thing was, ladies and gentlemen, that if, for example, you have your faith on these faith healers or those spiritual healers, there's just one thing which you can do and it will be fine for you, and that is that please continue your treatment with the doctor and then with the faith healer or probably the spiritual healer at the same time. That'll be the wisest thing to do. Don't you agree with that?
Absolutely. I mean, there's no.
I mean, if, for example, if that spiritual healer is not going to cut you off probably, or, he's not going to do any surgery or operation, please don't let them do that. Let the doctor handle with that. And if you want both the treatments to go on, let them both be on.
Yeah, exactly.
I would like to mention one thing. These faith healers and these people are present because there is a loophole in the system. These people are easily accessible.
Yeah.
The doctors are not very easily accessible.
No.
One person living far off in a village, they
Yeah.
will have a readily available somebody like that instead of a doctor. So they go to those people first.
Yeah, but exactly. This is what we were discussing
Yeah.
about, making these hospitals within the cities when
Yeah.
actually most of your population is
It's
in the
about
rural
providing basic health units.
No, but that's
Okay.
not a loophole. We cannot just say that, all of them are wrong as well.
No,
Let's
but-
not do
No,
that.
but that's the thing. No, but it is correct, because the thing is, you need more people out there.
Yeah.
Basically,
Yes.
we need more manpower and more staff. Now, before we actually run out of time, this is really important. Because we've seen, especially some celebrities as well, like Angelina Jolie, she's done it. She's the only one that's coming into my head right now. But preventative surgery. I'll ask you, Dr. Uzma, do you recommend that? Is that good? How does one go about it? When should one do it? And then I'll move on to you, Mr. Umar, to see if that's what you guys also recommend when you're raising awareness.
Well, preventive surgery is one of the last options which is offered to patients in whom the genetic risk is very high.
And how do we assess that?
What is
Yes.
that preventive surgery? I mean, you still haven't got it, but you're getting a surgery done.
The genetic risk we detect by having the patient screened their genes. Once they have a strong family history, they go out and have their genetic test done for the risks. And there are some particular genes which you are testing positive for those genes, then you have a high risk of cancer developing in any stage of your life.
Okay.
So one thing is just to sit back and have a regular, a very, you can say, if not a normal person with an average risk has a screening mammography or ultrasound every year, this one goes around and has it every 3 months or 6 months just to get an early detection or if you can't go into that hassle, what Angelina Jolie did, it was a very radical step, I think, to have a preventive surgery, that you get your surgery done before even, because your breasts, the breast tissue is at risk of developing cancer, so have them removed. Once you don't have it, you don't have the risk of getting the cancer.
And then you can also get everything else removed as well, right?
No, we can't.
But I thought she had the ovaries.
No,
and-
she had she had a reconstructive surgery. What we call, there's a kind of surgery which is called skin sparing mastectomies, in which you just take out the breast tissue under the skin, and the whole skin and the nipple are intact, and you fill it. There are some prosthetic devices, and there are some
Okay.
tissues that you take from other parts of the body and fill it up there.
Interesting. And in regard, so obviously this is not something that we are raising the awareness in the rural areas.
Yeah, and this is, we don't have in Pakistan BRCA1, BRCA2 tests. We
And
can't
this
do
is
it.
what they use.
Yeah, so that's,
Yeah, these
the
are the main
genes.
genes
the
that
genes.
are categorized as breast cancer genes.
Yeah. So
Once you have them positive, then you have a high risk of having breast cancer.
So, and again, sitting in Pakistan, talking about 80% of population who would not even do their self-examination, who don't want to talk about this issue. So I think preventive surgery is yeah, it's a far-flung.
Okay, well, one last thing which I wanted to ask, and that is for all those people who are underprivileged, cannot afford, are there any other options for them to go to a doctor or probably get it treated? Is your foundation doing anything in that regard?
So first of all, the message of Pink Ribbon is to go for early detection. So if women, they do their self-examination every month, so they can detect anything, any change at the earliest possible time, and it will be less painful and less expensive. So that's the whole message of our campaign. And then there are like 14 atomic energy hospitals. They are available. Inshallah, in next 2 years' time, we will be having our hospital as well. But again, early detection is the best way to survive breast cancer.
All right.
great. And Ms. Catalina, do you have anything that you would like to share with all of our viewers?
I think the most important thing is that if you're worried about it, that's in general, do something about it. And self-examination, very, very important. And just reach out to people like the Pink Ribbon or your doctor so that they can help you and guide you towards the right place. So I really think we are breaking these taboos. Pink Ribbon is doing that, and now we only have to look forward for people coming and having themselves examined and inshallah getting cured.
Very
Great,
wise.
thank you so much. And Dr. Uzma, would you like to say anything to all of our viewers?
Well, it's a good thing. We do also see patients in an earlier stage, and girls just coming up for just a clinical examination. Once they did their self-examination, they felt there was something suspicious. So we do see people turning out at an earlier and at a screening level tests. They
Wonderful.
do come up. Yeah.
Great. Thank you so much for your time and being here with us today. And I hope the rest of the campaign and the month goes well in regards to awareness. So guys, that was information on Breast Cancer Awareness Month.
Yes.
And the situation, as we've just realized in Pakistan, it's pretty bad. And we need to look after our women and our men, but we need to look after them because they're going to have babies, and then they have to raise the babies,
Exactly.
and they have to look after the babies, and they have to look after the husbands who are also babies. No kidding.
And if
but-
you think that there is a problem, I think we've shared the hotline
Yes,
number as well,
we
which
do.
is 358-37226.
Well-
042 is the country code.
Well remembered. I wrote it down.
It's the imagery memory, but it's perfectly all right. So, if you don't want to discuss with anyone, just call on this number. There'll be ladies talking to you, right? Ladies, women talking to you as well. So you can share it with them. They'll tell you what the procedure is, how it is like. And please don't be scared of it because your life does matter.
Exactly. And with that, do log on to our Facebook fan page,
Which is with the name of World This Morning.
our Twitter page,
World This Morning without a G.
our Daily Motion and YouTube
World
page.
This Morning once again.
And the repeat is that.
11
Have
p.m.
a wonderful day, and we will see you bright and early very soon.
Till the next time, look after yourself. 1, 2, 3. Good morning.